Okay, this video is called, Is Harvard Medical School a Clown School? And why do I say this? Because I've had a change in my opinion since I was a young guy. When I was a young guy, I was kind of in awe of the Harvard textbooks and stuff. And now that I'm older, a lot more experienced, and I've studied the medical literature a lot more, I realize they're actually quite ridiculous very often. For example, this Walter Willett is like the head of the Harvard School of Public Health. Look at his food pyramid. It's not even mediocre. It's completely wrong. He puts right near the bottom of the pyramid, he recommends a person eat a lot of oils. Okay, and he doesn't even just say olive oil, which is bad enough. He also recommends soy, corn, sunflower. These are all terrible omega-6 fats. This is a disaster for health. Okay, and he puts it right on the structure base of his pyramid. This is stupid. Completely wrong, okay? Then he recommends meat. Anybody who studied meat even just a little bit knows it's the major risk factor for causing cancer. It's also major risk factor for atherosclerosis. It's acidic. The amino acid composition of meat is different than that of plants. A lot more sulfur-containing amino acids, methionine, that increases cancer risk. Also more leucine, activates mTOR, branched-chain amino acids. It's all bad. Meat is for chumps. Okay, then over here he's recommending a lot of high-fat foods, recommending soy. There's a lot of problems with soy. We've talked about that in other lectures. Then he recommends dairy. Okay, dairy is a disaster for health. You know, big increase in autoimmune disease, not to mention it's a risk factor for type 1 diabetes, coronary artery disease, etc. This diet is so stupid. You know, if a college student handed this in and I was teaching a nutrition class, they would flunk. I mean, that's how ridiculous that is. It's totally, you can bet, it's a safe bet, there was a lot of industry influence in coming up with this. It's ridiculous, okay? Then he recommends vitamin D, like the opposite of what McDougall says. He'll never prescribe it unless you got an institutionalized female with no access to sunlight. Otherwise, by far, a million times over, get your your vitamin D from the sun if you can. Alcohol says it's okay. No, people should not drink any alcohol if they want to optimize their health. Anyways, I just show you this to see how ridiculous it is. And this is the head public health guy from Harvard. It's, like I said, it's not even mediocre. It's completely wrong and stupid, okay? And so now, with that in mind, now we'll go to the other topics. When I was in med school, I won the award, 333 students at my medical school class, best student in the class in pathology, and I was kind of in awe of the book, the big Robbins and Cotran, Pathologic Basis of Disease, Harvard textbook of pathology, and it's like a big monster of a book. How many pages is it here? I got it right in front of me. It's, you know, close to 1,400 pages, a recent edition, I think 2015 edition or something like that. Okay, so we talked about that. I've also seen a lot of Harvard-affiliated doctors promoting the Mediterranean diet, which is for chumps. They got a psychiatrist right now who's promoting the ketogenic diet for mental health disorders. Now, I actually like that guy, Chris Palmer, and I think he's right about a lot of things. I don't agree with the ketogenic diet, but I'll talk about that some other day. But I actually like him. He's done some good things. I think he's wrong on the ketogenic diet, but I think he's right about a lot of things. So I'm actually in the process of reading his book, Brain Energy, and I find it entertaining, but I'll talk about that later, so that's interesting. Okay, Harvard psychiatrists are known for recommending all these medications for these pediatric attention deficit and other so-called mental health disorders. Even though it's known, if you study that a bit, you'll see there's relatively poor long-term outcomes. They often get on multiple psych meds, and that's not good. Harvard Psychiatry is associated with promoting SSRIs for depression, which are very overrated and relatively poor long-term outcomes. The cardiology books emphasize pill stents and surgery for coronary artery disease, but it's well known, dramatically better results with a low-fat vegan diet. There's no mention of the low-fat vegan diet. I don't recall seeing the names of Kempner, Pritikin, Ornish, or Esselstyn in there. Those are the pioneers of coronary artery disease, showing that it could be stabilized and reversed readily with that. Kempner showed a bunch of reversed EKGs. Pritikin showed patients dramatically improved. Ornish had reverse SPECT scans. Esselstyn had reverse cardiac cath on some patients. Okay, Harvard pathology book and cardiovascular physiology book. When you look at hypertension, they keep telling you, I forget the exact number. I think they ballparked it around 90% of hypertension being essential, meaning idiopathic of unknown cause. And that's absolute nonsense. We know in a plant-based population that doesn't add salt to their food, they don't ever get hypertension, okay? You can look at the Yanomamo, you can look at the Tarahumara, you can look at other populations. No mention of the work of Kempner, dramatic reversals of hypertension with a low-fat vegan diet using a rice-based diet, patients' systolics in the mid-200s coming down to normal. Pritikin's work, McDougall, they were reversing, they said, at least in the ballpark of 90% or more of the patients. It depends how long the patient has it, how severe it is. Richard Moore is a guy who wrote, MD, PhD, wrote the great book on the role of sodium in hypertension. And how important potassium was. So you just eat plant foods. P for plants, P for potassium. In addition, in plants you get magnesium. Magnesium is right in the center of chlorophyll, whereas in a meat or a processed food diet, there's tons of sodium, the exact opposite of what you want. You want high dietary potassium and magnesium. That lowers your blood pressure, whereas sodium raises it. Okay, Harvard pathology book and CV book now with regard to atherosclerosis. They don't even mention atherothrombosis, which is by far the best theory of atherosclerosis. I've been studying atherosclerosis for about 25 years. I did a vascular interventional radiology imaging guided surgery fellowship at Harvard with the emphasis in vascular disease. I've been interested in it for a long, long time. I've read tons and tons of papers on the subject. I look at it every day when I look at CT angiograms, MR angiograms, and catheter angiograms, etc. I've seen many, 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 many thousands of these things. And I can assure you, atherothrombosis is by far the best theory. They don't even talk about it. And the persons who did the best work on it are William Roberts. He's a pathologist. Gregory Sloop is also a pathologist. He's out of Texas. He wrote like the best paper ever on coronary artery disease, the one about like 2,000 autopsy studies of patients who died of myocardial infarction. And he explains there's no such thing as single vessel disease. It's always diffuse, always diffuse. Sloop sort of tied together mechanisms of increased blood viscosity and explanations of hemorrheology, the way that thickening of the blood due to elevated hematocrit or rouleau formation, let's say from LDL cholesterol, blood sludge. And I've talked recently, I gave a lecture on the effect of high-fat diet on making the blood higher viscosity, as well as the other things, how it injures the endothelium. You can injure the endothelium from sodium. You can injure the endothelium just from the high-fat diet as it relates to increasing myeloperoxidase, causes LPS endotoxemia, postprandial as well. Okay, but what I mentioned is none of the key stuff is in the book. And then they're sort of famous for doing all this research talking about inflammation and coronary artery disease and atherosclerosis. But guess what? Esselstyn's diet's able to reverse all that stuff. And, why would that be? My speculation is because once you avoid the meat and the processed foods, you don't get leaky gut. So you're much less likely to get leaky gut. So you avoid the postprandial LPS endotoxemia, and you avoid a lot of the other things that go with a meat and processed food diet. You avoid the TMAO, you avoid the xenocellulitis. Okay, so what I'm saying is, if you claim that inflammation is a big deal, you can prescribe another medication for it. Versus if you just fix the diet, you fix the problem. It's a non-issue. Esselstyn had success in 198 out of 198 patients at 4 years who just followed his diet. July 2014, Journal of Family Practice is where he showed that. Okay, then if you read about diabetes in the Harvard textbooks of pathology, and I also looked at one of the internal medicine books, and I don't recall. It's been a while since I looked at that book, but I don't recall seeing any mention. The Sweeney paper, the Hemsworth paper, Rabinowitz paper, those are the standard ones showing fat causes insulin resistance, based on clinical experience. And then Brownlee showed it in much more detail, the molecular biology and biochemistry of it. Shulman showed it with nuclear magnetic resonance spectroscopy. Roy Taylor showed you can reverse it with diet, and he also worked with Shulman on the NMR techniques for showing early insulin resistance. So what I'm trying to say is these are all the pioneers of atherosclerosis. He's the Banting Award winner in 2004, Banting Award winner in 2018. Taylor, I forgot what year he was the Banting Award winner, something like 2012. But what I'm saying is these are the best diabetes researchers in the world. And they did the best work on it. These guys are all geniuses. They're not in the book. They're not taught to students, okay? None of this stuff. I can also tell you, I told you a funny story. It was sort of a local so-called expert in diabetes. I went to talk just to see if I could learn anything about diabetes. And this endocrinology attending had not read a single paper. This was at a local medical school. This is not Harvard, this attending I'm talking about. But in my experience, that's pretty typical. A lot of so-called experts in diabetes, they know all the medications, but they don't know anything about the pathophysiology of the disease, which means they don't know the fact that you could usually reverse type 2 diabetes pretty easily with a low-fat vegan diet, especially if you catch it within the first 4 years. And Roy Taylor had shown that rather well. Okay, what else? Harvard pathology book on autoimmune disease. No mention of leaky gut. So the fundamental, most important thing in all of rheumatology, the most important cause of autoimmune disease, is not even mentioned in the chapter. So you see where I'm getting at? These are major, major, major common diseases. And they are either out to lunch or wrong on these topics. That's kind of a big deal when the place that's known as, perhaps the best medical school in the world, they used to call, Massachusetts General Hospital, MGH. There was a great book called The House of God. It was a real entertaining book about what it's like to do an internal medicine internship. And they called MGH man's greatest hospital, okay? And so, don't get me wrong, it actually is a great hospital for a lot of high-tech stuff. And conventional medicine's great for emergency room problems, acute problems. It's great for end-stage things like, kidney failure patient, put them on dialysis. It's great at that. Doing a transplant, it's great at that. But the vast majority of patients, they've got these chronic diseases that gradually drag them down into the grave, drag them into health hell. And quite frankly, conventional medicine stinks at the treatment and understanding of these diseases. Almost everything useful that I've learned about these diseases, I learned it all from reading, the medical literature on my own and reading legacy books of guys getting ready to retire. That's when guys will tell you the truth more. They don't kiss butt to the system. They just tell you, and they summarize it clearly. They unify everything in their field. That's why I've learned a lot from those types of books. Like Richard Moore's book on hypertension is the best one ever written. It's a masterpiece. Okay, and then there's this guy, Siddhartha Mukherjee. Now I like him. He's a Rhodes Scholar. He's real clever, real articulate. He's a pleasant guy, and he writes these books sort of, about a medical student or like an intelligent layperson's level. But what I'm saying is he's an oncologist. He also did a PhD in immunology. He wrote a book called Cancer, the Emperor of All Maladies, And he also wrote, the history of the gene, and he wrote Signature of the Cell. And his books are kind of fun. I listened to the audio CD in the car. But what am I saying is, he never gets to the point. All he does is talk about baby stuff that you learn by the time you're a second-year medical student. He doesn't even explain that the somatic theory of cancer has been refuted. Okay, it's been refuted. The Genome Atlas product has shown that you can't explain these cancers by their pattern of mutations, all right? There are a few exceptions, but that's pretty strong stuff. Metabolic theory of cancer has largely been proven. He barely mentions that. He doesn't go into the benefits of low-fat, low-sodium vegan diet, how much is known about that. And he actually is, in his practice, I heard he was like working on research about the ketogenic diet for cancer. That's stupid, okay? If you've studied nutrition and the biochemistry of cancer, it's pretty clear you're not going to get around glutamine. And look at the other guy, Seifried. He did some good work on metabolic theory of cancer. I like him too. But, your ketogenic path is stupid, okay? It's going to make cancer worse. And then Seifried's talking about lowering the glucose levels further with drugs. Well, if you go too low on your glucose levels in your blood, then you're going to make the brain deprived of glucose and you're going to have cognitive impairment. So that's not a good idea. I've talked about the biochemistry of cancer rather extensively, and I don't want to go into it anymore. But what I'm trying to say is their big textbook and their big so-called expert really don't tell people and don't include in their books the stuff that you need to know about cancer. You need to know the metabolic theory. You can't make sense of cancer until you have the metabolic theory, okay? The Warburg effect and all this other stuff. So I'm sorry, but they're pretty pathetic is what I think. Okay. Harvard pathology book, on the topic of, arthritis, okay? There's no significant mention of the role of meat and ultra-processed foods, UPF is ultra-processed foods, for increasing systemic inflammation, causing, sat fat and whatnot, causing tissue ischemia. So when the joints are hypoxic, and Nathan Pritikin wrote about this a lot, and I've written about it as well, tissue ischemia is going to cause joint arthritis. There's other chemical components, but they're less common. I could go into the biochemistry of arthritis too, but we're not going to do that right here. But what I'm saying is this is basic. Systemic inflammation due to meat and ultra-processed foods, tissue ischemia, and autoimmune arthritis. Basic stuff. I don't recall seeing that stuff covered, okay? Harvard pathology book and neurology books with regard to dementia. There's no mention of Jack Delatorre theory of dementia. He's the guy who tied off the mouse carotids. That's the best explanation of dementia ever, okay? There's also my theory, neurovascular uncoupling, but mine's not that well known, but mine's also. These are the two best theories of dementia. The same old nonsense about Alzheimer's. By the way, Alzheimer's disease is pretty much of a joke. I mean, think about it. There's no historical finding to make the diagnosis, so you can't ask the patient a question and confirm they have it. You can't do a physical exam finding to confirm they have it, so there's no symptom, there's no sign, medical physician observation. There's no blood test to diagnose it, right? There's no imaging test that effectively diagnoses it. There's some imaging tests that suggest it. For example, excessive atrophy of the medial temporal lobe and hippocampus, as well as perhaps the parietal lobe. I almost never see that pattern when I look at tons of brain MRIs, okay? Then there's the talk about the nuclear medicine test, which is quite overrated. I know there's some information about that, and there's some usefulness to it, but what I'm trying to say is there's no definitive accurate and effective and highly reliable method to diagnose it. Even at autopsy, they can't be sure they're dealing with Alzheimer's. That's partly where you got that ex post facto stuff about Minnesota, Mankato, Minnesota, the Notre Dame nun study with cognitive reserve theory, trying to explain away the excessive, plaques and tangles in the nuns that weren't demented. Okay, what else? Talking about ischemic spinal degeneration. They don't explain that. And of course, I've written a lot about that, but that's not well known, my writing on it. But, I figured out it's not just ischemic spinal degenerative disc disease in the lumbar spine. It explains pretty much everything in spinal degeneration, extending from the sacrum all the way up to the skull, every single disc base level, and the associated disc, diffuse idiopathic skeletal hyperostosis, and bridging osteophytes, and autofusion of the spine, interbody disc fusion, and calcification, ossification of the posterior longitudinal ligament, ossification of ligamentum flavum, etc., with eventual autofused spine leading to chalk stick fractures and paraplegia. Okay, I've seen tons of those cases. All right. So what am I saying is, young people, they go into medicine because they want to learn how to help people, and it's sort of like climbing Mount Everest in a medical student's mind. If only they could learn everything in the Harvard textbook of pathology. That's how I used to think. And the Harvard, textbooks relating to internal medicine topics, for example. And I've actually gotten there. I've read these books. And guess what? The answers aren't there. You will find answers to the questions that you still want answered when you start reading about nutrition. And you'll find that the low-fat, low-sodium vegan diet is the holy grail of health, because the vast majority of diseases, at least 65%, and it's probably about 75%, are primarily due to diet and toxicology. So you're going to have to study toxicology as well, but the bulk of it is what you're going to find in food, the problems related to processed food and meat and these oils and some of those things. So anyways, I just help you this because, part of figuring out where you can find the answer to help yourself with your health problems and understanding stuff and becoming a better doctor or just becoming better able to help take care of yourself, they come from understanding all this stuff. And that's why I joked in a previous post that the difference between somebody who understands nutrition and toxicology in terms of their ability to help themselves or their patients is like the difference between a Lilliputian and a Gulliver. So anyways, hope this was helpful.